Hi, Dr. Andrea Maxim, naturopathic doctor here in Caledonia and Oakville, Ontario. And today I wanted to give my own personal advice to those young teens, early 20s women that have just recently heard about the new guidelines put out by the CMAJ. What that is the Canadian Medical Association. In January of this year, they have now cut back the guidelines on proper cervical cancer screening. That screening is when we do our annual PAPs. Now, instead of doing it annually, they are now recommending that girls under the age of 20 don't need to have a routine PAP done, and women between the ages of 20 and 29, especially those that are 25 to 29, can opt in for an annual PAP if they want. Otherwise, they don't need to come back until every 3 years. Now, what I will say to you ladies is you need to be putting your health into your own hands. And I can tell you from my own personal experience, the only reason why my health is as good as it is because I did those annual PAP screens. And if I had been following the new guidelines, I probably wouldn't have detected the cervical dysplasia that they found in my body. So I was going for routine PAPs. I'd been on the birth control pill chronically for 10 years. And it wasn't until one PAP just came up abnormal. 6 months later, we checked it again, still abnormal. I had to go to the colposcopy clinic in the hospital and get a biopsy done. They found that the cells were one stage before carcinoma in situ. Carcinoma in situ is one stage before cervical cancer. Had I waited 3 years from my last normal PAP to the next one, they probably would have missed those abnormal cells, and I might have to go through some sort of cancer treatment. And so what I did was I automatically stopped using the pill. I went on a really high nutrient supplements orally as well as suppository every single night for 3 months. And I licked it as quickly as I could, but I still had to go in for surgery. And it took about 1.5 years for me to finally get cleared of any abnormal cells that were on my cervix. And it is not something I ever want any of my girls to go through. I don't want your moms to be worried about you like mine was. And it just isn't worth it. And I know as women, we don't like the whole procedure. We don't like getting, naked and wearing the gowns on the table and having our doctors go into that little area. But for 5 minutes of discomfort, it really is more of a benefit to you than it is a risk. And the biggest thing that we always try to discuss with our patients as a naturopath is we are in preventative care. And these annual PAP screens is the best preventative care you have against your reproductive health. So I strongly encourage you to really think about the risk-benefit ratio. Is it worth the risk of waiting 3 years just so you don't have to go through that uncomfortable screening process than the risk of potentially developing cancer and having it go undetected for 3 years? If your medical doctor will not test you annually, or if they ask you to pay out of pocket for it, please pay out of pocket. And if your medical doctor won't do it for you, and it might not be necessarily their fault because they are governed by the government, find another medical doctor who will, or find a naturopathic clinic who will do that for you. Please do not let those guidelines dictate how you control your body, because ultimately it's always going to be up to you. And it's worth the money to get that peace of mind to know that you are doing everything right. For those people that are currently taking the birth control pill, I strongly, strongly urge you, no matter what age you are, to get annual PAPs. The reason why is because the birth control pill will automatically deplete your body of B vitamins, of folic acid, of zinc, and of magnesium. And all of those nutrients are necessary for a healthy immune system and healthy cell turnover. And what is it that causes cervical dysplasia or cancers to start happening? It's usually when the cells start dividing abnormally and the body doesn't detect it. So we need to have those B vitamins, we need to have those minerals, we need to have folic acid there in place to allow our cells to replicate in a normal, healthy way to prevent any mistakes that happen in the body. please, 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 if you do nothing else, just pay for the annual screens and be very proactive about your health, especially when it comes to your reproductive health. Any questions, concerns, please feel free to contact me, and have a happy and healthy day.